Don't let your examiner know I told you this. In this video, I'm going to be sharing with you crazy tips you use to pass your OSCE. Especially those beautiful souls that are going into the exam hall to write their OSCE on Friday for their nursing council exam. This video is for you. Everything depends on how you enter the exam hall. Telling you to appear confident is an understatement. As you're going into that hall, listen to me. I'm telling you from experience. See yourself as the director of nursing services in the hospital where you have been doing your clinical posting. Whether it's teaching hospital, FMC, anywhere you are doing your clinical posting. See yourself as the director of nursing services. That is the kind of confidence I want you to have, because those women are not going to eat you up. Carry yourself up. Make sure you are properly dressed, your hair is neat. For the guys, your beards, you want to shave them off, and make sure you appear confident. Remember, I said the confidence level you need is that of the director of nursing services in your teaching hospital. And then, as you enter into the hall, you greet the examiner. Good afternoon, ma, or good morning, ma. I am exam number 214. Read the instruction on the station as you're about to start your procedure. I'm here to catheterize Mrs. Jones. The first thing you want to do as you approach that patient is to greet the patient, explain the procedure to him, and seek consent. You say, good afternoon, Mr. Jones. I am nurse 214 and I'm here to carry out a procedure of catheterization. It involves me passing a pipe through your urethra for you to urinate. Can I go on? You find out that with that sweet tone, Mr. Jones will say, okay, you can go ahead. And then you report to the examiner, Mr. Jones has given his consent. After obtaining consent, the next thing you want to do is to perform hand hygiene. Don't forget hand hygiene. Any procedure that has to do with a patient, you must perform hand hygiene. After performing hand hygiene, you dry your hands and wear your gloves. After that, you provide privacy for your patient. If you have sharp eyes to see what the examiner is speaking, by the time you've gotten to this point, find out that you've almost scored about 50%. Before you now go deep into the procedure, start telling your examiner, I will do this, I will do that, I'll place my patient in dorsal recumbent position, all those formalities. Before you get there, you find that you have gotten almost 50% of the total mark you need for that station. Another tip I want to give you about confidence is that if you forget any step in your procedure, maybe you skip a step, don't let that mark be lost. See, if you skip a step, let's say maybe you forgot to provide privacy. You look your examiner and I say, Ma, remember that I provided privacy, I screened this patient. If you find out that after telling your examiner that you went back to screen your patient, your examiner is going to go back and tick for you. That's on the checklist that you've provided privacy for your patient. So don't let anything make your mark slip away. Remember that if you fail paper one, when you're coming to the right, it's only paper one you rewrite. Same applies to paper two. But if you have issues with paper three, my dear, you are starting the whole process. And I don't want that for any of my I don't want that for any nursing student, because it is a very traumatic experience. That nursing council exam is an exam you have to go into the hall once and pass it. Now you've done the preliminaries. These are the basic things you must do before you start any procedure. As you go on in your procedure, make sure that you still keep that confidence level. You can also mimic the confidence level of your director of nursing services or your clinical instructor in your demonstration room. Have that confidence. See yourself as the clinical instructor and examiner as your student. That is how to do it. There is no big deal about OSCE. In fact, OSCE is the easiest exam in nursing. If you remove tension, carry yourself confidently, and be smart, OSCEs are not difficult. And then when you have finished your procedure, make sure that your patient is very comfortable and you discard all the used materials. Even in this video, I forgot one thing you should do in the preliminary stage. Make sure that you mention all the items you are seeing before you, and then you gather your supplies before starting your procedure. If you have a tray there, tell them, ma, this is a tray procedure. If it's a trolley you are saying there, say this is a trolley procedure. List out all the things that you have in the trolley. You even get up to 60% by the by the time you've listed out all these things, even before you start your procedure. So the OSCE is not only looking at how good you are in the procedure, it's looking at how you establish rapport with the patient, how you take care of this patient. Not because they brought a doll for you, treat the doll anyhow. No, that doll is a real patient. In fact, see that doll as your family member. The way you take care of your loved one, that is the way you handle that doll. Hmm? If you've watched this video up to this point, make sure you click on the plus button, follow me, and subscribe to this channel so that you won't miss out on any of our uploads. Because in this channel, we'll be giving you back-to-back updates about nursing. And then for your Viva, I've done 2 detailed videos on how you will defend your project. So I'll be leaving the link in the comment section so that you can go to YouTube and watch all those videos. They're going to help you. Come next week, I'm going to celebrate you, future registered nurses. You've got this.